Hypertension is one of our biggest challenges when talking about chronic diseases. We have seen over the years that there are many patients that are prescribed medication for hypertension and they just don't take them because of the side effects, which is dry mouth or dizziness. And so those patients, it is important to explain to them that the medication is essential and sometimes they need to go back to their prescribing physician for it to be replacing that drug with a different drug. But we can also help them a lot by using natural medicine. For example, garlic, Allium sativum, is estimated to modulate the endothelial production of nitric oxide, inhibit the angiotensin converting enzyme ACE activity, and have a strong free radical scavenging activity. So it can help protect our arteries, it can help modulate and improve the function of our arteries, and a reduction reported of about 7 to 9 millimeter in systolic blood pressure and about 4 to 6 millimeter diastolic blood pressure, which is the bottom number, in patients with high blood pressure. The dosage is 150 to 750 milligrams of garlic tablets twice a day, or 500 milligrams of garlic oil per day with fish oil. Remember, the fish oil can also help to reduce inflammation, improve the lipid panel of LDL, HDL ratios. So combining fish oil with garlic oil could be a really good beneficial thing to do. Some supplement manufacturers are now introducing garlic tablets that already have parsley extract in them to prevent the side effects of taking high amounts of garlic, which is the smell that the garlic breath, as some people call it, right? So patients can choose capsules that also have parsley in them or parsley extract to help to mitigate that. Now let's talk about Silybum marianum, which is milk thistle. We previously talked about milk thistle as a helpful herb in detoxification pathway, right? It's also reported to be beneficial in reduction of blood pressure, possibly by improving liver function and integrity and reducing portal hypertension. So as we learned in the nutritional module and the physiology of digestion, the nutrients are being absorbed from the digestion tract into a vein, a large vein that is called the portal vein. Portal vein goes back into the liver where all the food that we're eating and all those nutrients, together with other chemicals that are in our food, are being metabolized, broken down, or absorbed into our body. If there are issues with liver function or liver integrity, it's almost like the best analysis or best picture that I have in my head is a picture of a clotted filter. What happens if the gas filter in your car is clogged, right? There's too much chemicals and accumulation of dirt in the filter, right? Gas, when you press the gas pedal, gas won't be able to go from the gas tank into the engine, right? Because you're going to try and get more gas into the engine, but the filter will be blocked, right? That will create higher pressure in that tube that leads gas into the filter. So portal hypertension is where the liver, let's call it in terms of oversimplification, liver congestion. What will happen with liver congestion is there's going to be accumulation of pressure in the portal vein. It's just not going to flow well from the liver on to other organs and other parts of our body. So what will happen is it will be accumulation of tension, higher tension in those veins, in the portal vein, and that can lead to systemically to higher blood pressure. So by helping the integrity of the liver, helping, let's call it, to clean the liver, right? We're basically helping the function and the integrity of the liver. You help to keep that flow of blood through the liver in a healthier way and reduce that portal hypertension. So the dosages will typically be 200 milligrams to 420 milligrams per day. Higher dosage are something needed, with some reports are up to 1200 milligrams per day or even twice as much, right? Remember that it can also increase the metabolism of the liver or support detoxification. So be cautious when a patient is already taking drugs, because you can either metabolize them faster and have lower amounts, or they have less amounts that are actually absorbed into the body. They're going to eliminate a lot more of the active ingredient in their drugs, which can cause them even higher blood pressure. Typically, I like to start slow and increase it over several months while you monitor the patient's well-being, right? So that's really, really important to do that. Another herb that I wanted to mention is Leonorus cardiaca, also referred to as motherwort, traditionally used as sedative and support in heart function. Reports to help with reduction in blood pressure, heart rate, with stage 1 and 2 hypertension, as well as headaches and sleep disorder. And with anxiety and depression, patients that are experiencing those symptoms, there were reports of significant reduction in 32% and moderate improvement in 48% of patients in that study. You can see how some of those herbs that are used for hypertension can also use for anxiety, for depression, for headaches or sleep disorders. Typically, patients with hypertension, with many of them, we have found that from our clinical experience that many of them have higher levels of inflammatory cytokines. So when we tested, for example, their LDL, HDL, their lipid profile, when we tested for not just lipoproteins, but we tested other inflammatory markers, for example, C-reactive protein, those will tend to be higher. And so we want to make sure that we also help those patients in reduction of inflammation, right? So for that reason, you can also use curcumin, which also helps with liver function and inflammation. There's a variety of plants that you can use that are anti-inflammatory to help those patients. Dosage of Leonorus cardiaca will typically be 1200 milligrams per day of Leonorus oil extract as a tincture, would be 1 to 4 milliliter twice a day. Now, omega-3 can also be helpful with hypertension, and also remember to always recommend those patients stress management practices, because we have seen patients that their hypertension is completely emotional, which means that every time that they're stressed, they go to work, they have a certain project, their blood pressure start going up, and that could be their adrenals are no longer functioning as well, and that would be in the functional approach, adrenal insufficiency. So your adrenals, every time they're stressed, they produce cortisol, which regulates blood pressure, increase the sugar levels, and it also have a mild calming and anti-inflammatory effect. So with those patients, every time they're stressed, over the long term, they're losing their ability to manage stress physiologically, right? And in functional medicine, we call it adrenal insufficiency or subclinical adrenal insufficiency. So we have seen patients that were able to have a significant reduction in their blood pressure just by meditating, taking a walk once a day with a friend, or just reading a good book and just doing breathing exercises, right? So always ask your patients, what have led to that higher blood pressure? What do you think that is causing you high blood pressure? When have you noticed, if you measure on a daily basis, that your blood pressure is higher? How is it before when you wake up? How is it after you come back from work, right? We want to try to identify what triggered that hypertension with these patients.